Harriet Hoff. I'm professor of anesthesiology and biomedical engineering at the University of Utah. My research focuses on actions anesthesiologists can take to reduce healthcare-associated infections. This work has suddenly become trendy during the COVID-19 pandemic. I'm here today to talk about infection control in the context of dual infection risks to patients as well as to healthcare professionals. Our second question is, how can anesthesia clinicians better protect their patients from cross-contamination? Well, as I'm sure you're all tired of hearing, hand hygiene is the cornerstone of healthcare infection prevention. When anesthesia professionals do more frequent hand hygiene, it reduces the risk of healthcare-associated infections in their patient, largely by reducing contamination of the workspace and particularly of the patient's IV catheter ports. The World Health Organization used to say you need to do hand hygiene before you enter and exit the room, which means an anesthesiologist would do it less than once an hour in most circumstances. But that turns out not to be effective in terms of when your hands are contaminated and might transfer bacteria. So they came out a few years ago with the 5 moments of hand hygiene, which looks at the possibility that your hands are contaminated and when you should do hand hygiene. The 5 moments include before and after touching the patient, before and after touching the patient's environment, whenever you come in contact with patient's blood and body fluids or a container containing that, and before aseptic procedures. That means as anesthesiologists, we should be doing hand hygiene about 20 times an hour, particularly during induction and extubation, when there's a lot of opportunities for contaminating the hands, such as when you put on the monitors or during intubation and extubation. I personally, around the time of induction, do hand hygiene about 40 to 60 times an hour. When you think about the anesthesia space, it consists of the operating room table, usually with a patient on it, the anesthesia machine, the circuit that connects the two, and the anesthesia cart. If you consider those all part of the same environment, it would make it very difficult to get any work done. You'd have to move the cart outside the room, for example, to keep things clean. So we've established the idea practically that the anesthesia cart is in a separate space and it is not considered part of the patient's environment. Thus, if the patient's environment consists of the operating room table, the anesthesia machine, and the circuit, anytime you touch that, you need to do hand hygiene. Similarly, the cart is not part of that environment, but because it's like going out of the room, you need to do hand hygiene before you touch the cart, and particularly any time that you've touched the anesthesia workspace. During COVID-19, we've obviously made some adjustments to think about that workspace and keeping it clean. There have been lots of inventions of ways to try to reduce contamination of the workspace, because now we're not just worried about getting the patient cross-contaminated, we're also worried about getting sick ourselves from virus that is spread around the workspace. Now, part of the workspace is the anesthesia machine, and part of what we think about there is the outside of the anesthesia machine. So are the surfaces clean? The other thing to think about is the inside of the anesthesia machine. So the ventilation system, which would be the airway, the circuit, and internal machine components. So how do you protect the machine from the patient and then the patient from previous patients, particularly related to exhaled pathogens? The recommendation is to use high-efficiency filtration devices to protect the machine from the patient and the patient from the machine. The COVID-19 pandemic raised awareness amongst anesthesiology professionals of the importance of filters in protecting the machine from the patient and the patient from the machine. And it also highlighted a lack of knowledge about how filtration devices work, what kind you want to use, and where they should be placed. So that there was a lot of debate early in the COVID-19 pandemic about the best way to deploy the filters. In our next segment, I'm going to try to dispel a lot of the confusion around filters by going deeply into what are they, what is required of them, and where should you put them. Thank you very much for watching this segment on reducing cross-contamination in the operating room.